Hello, this is the Suburban Prepper. Today we are going over the 30 most common antibiotics, antivirals, antifungals, and antiparasitic medications, including their dose, indications, and warnings. This is for all you preppers, survivalists, homesteaders, and other baddies. Please enjoy. Antibiotics, Amoxicillin. Dose, adults, 500 milligrams every 8 hours or 875 milligrams every 12 hours. Indications, respiratory tract infections, urinary tract infections, otitis media. Warnings, may cause allergic reactions in penicillin-sensitive patients. Report severe diarrhea as it could indicate C. Difficile infection, Azithromycin. Dose, 500 milligrams on day 1, then 250 milligrams once daily for 4 days. Indications, respiratory infections, skin infections, sexually transmitted infections. Warnings, use cautiously in patients with a history of arrhythmias, can cause QT prolongation. Ciprofloxin. Dose, 500 to 750 milligrams every 12 hours. Indications, urinary tract infections, gastroenteritis, sinusitis, bone and joint infections. Warnings, avoid in children and pregnant women due to risk of tendon rupture. Watch for photosensitivity. Doxycycline. Dose, 100 milligrams every 12 hours. Indications, acne, Lyme disease, malaria prophylaxis, respiratory infections. Warnings, avoid sun exposure as it may cause photosensitivity. Not recommended during pregnancy. Cephelexin. Dose, 250 to 500 milligrams every 6 hours. Indications, skin infections, urinary tract infections, respiratory infections. Warnings, cross-reactivity may occur in patients allergic to penicillins. Metronidazole. Dose, 500 milligrams every 8 hours. Indications, C. Difficile colitis, bacterial vaginosis, trichomoniasis. Warnings, avoid alcohol during and 48 hours after therapy, as it can cause a disulfiram-like reaction. Clindamycin. Dose, 300 to 450 milligrams every 6 to 8 hours. Indications, skin infections, bone infections, anaerobic infections. Warnings, risk of C. Difficile-associated diarrhea. Levofloxacin. Dose, 500 to 750 milligrams once daily. Indications, respiratory infections, urinary tract infections, pyelonephritis. Warnings, use caution in patients with known QT prolongation. Vancomycin. Dose IV, 15 to 20 milligrams per kilogram every 8 to 12 hours. Indications, MRSA infections, C. Difficile colitis, oral. Warnings, risk of red man syndrome if infused too rapidly. Requires close renal function monitoring. Nitrofurantoin. Dose, 100 milligrams every 12 hours. Indications, urinary tract infections. Warnings, contraindicated in renal impairment. Antivirals, Acyclovir. Dose, 400 milligrams every 8 hours. Oral. Indications, herpes simplex virus, varicella zoster virus infections. Warnings, ensure proper hydration to prevent nephrotoxicity. Valacyclovir. Dose, 1 gram every 12 hours. Indications, herpes simplex virus, shingles, herpes zoster. Warnings, may cause headache, nausea, or abdominal pain. Oseltamvir. Dose, 75 milligrams twice daily for 5 days. Indications, influenza treatment or prophylaxis. Warnings, can cause nausea and vomiting. Most effective within 48 hours of symptom onset. Remdesivir. Dose of E, 200 milligrams on day 1, then 100 milligrams daily for 5 to 10 days. Indications, COVID-19 treatment. Warnings, monitor liver function. Avoid in patients with severe renal impairment. Lamivudine. Dose, 150 milligrams twice daily or 300 milligrams once daily. Indications: HIV, chronic hepatitis B. Warnings: use caution in patients with lactic acidosis or hepatic issues. Antifungals: Fluconazole. Dose 150 milligrams once weekly or 200 to 400 milligrams daily for systemic infections. Indications: candidiasis, cryptococcal meningitis. Warnings: may cause liver enzyme elevation. Monitor for hepatotoxicity. Terbinafine. Dose 250 milligrams once daily. Indications: onychomycosis, tinea infections. Warnings: can cause liver damage. Monitor liver function tests. Voriconazole. Dose 6 milligrams per kilogram of V every 12 hours for 2 doses, then 4 milligrams per kilogram of V every 12 hours. Indications: aspergillosis, serious candida infections. Warnings: visual disturbances are a common side effect. Nystatin. Dose oral suspension 400,000 to 600,000 units 4 times daily. Indications: oral thrush, cutaneous fungal infections. Warnings: rarely causes gastrointestinal upset. Amphotericin B. Dose IV 0.25 to 1 milligram per kilogram daily. Indications: severe systemic fungal infections. Warnings: risk of nephrotoxicity and electrolyte imbalance, notably hypokalemia. Antiparasitics: Hydroxychloroquine. Dose 400 milligrams daily. Indications: malaria prophylaxis, rheumatoid arthritis, lupus. Warnings: can cause retinopathy. Regular eye exams necessary. Albendazole. Dose 400 milligrams is a single dose for many parasitic infections. Indications: neurocystic urcosis, hydatid disease, intestinal worms. Warnings: use caution in patients with hepatic impairment. Ivermectin. Dose 150 to 200 micrograms per kilogram is a single dose. Indications: strongyloidiasis, onchocerciasis, head lice. Warnings: may cause dizziness or allergic-like reactions due to parasite death. Metronidazole. Antiparasitic use. Dose 500 milligrams every 8 hours for 7 days. Indications: giardia, amoebiasis, trichomoniasis. Warnings: avoid alcohol during and after treatment. Praziquantel. Dose 20 milligrams per kilogram 3 times daily for 1 day. Indications: schistosomiasis, tapeworm infections. Warnings: can cause dizziness and malaise. Avoid activities requiring alertness. Permethrin Cream. Dose: apply to affected area, leave for 8 to 14 hours, wash off. Indications: scabies, head lice. Warnings: avoid contact with eyes, may cause scalp or skin irritation. Chloroquine. Dose 600 milligrams base, then 300 milligrams base 6 to 8 hours later. Indications: malaria, prevention, and treatment. Warnings: long-term use may cause retinopathy. Monitor renal and liver function. Permethrin. Dose 25 to 35 milligrams per kilogram per day divided into 3 doses. Indications: intestinal amoebiasis, leishmaniasis, off-label. Warnings: can cause nephrotoxicity and gastrointestinal upset. This guide provides general information. For specific dosing and recommendations, consult a healthcare professional. It is important to always follow the prescribed treatment plan and complete the full course of medication, even if symptoms improve. Failure to do so can lead to incomplete